Hey everybody, Rob Nursing here. Today I'm going to be covering why nurses should be CNAs before starting their career paths. If you don't know what a CNA is, CNAs are certified nursing assistants. They also go by PCIAs as well. Also, never miss another one of my videos. All you have to do is hit the bell button down below. And with all that being said, let's get started. So in this video, I'm going to explain the top 5 reasons on why nurses should be CNAs before going into their career paths. CNAs are considered to be highly valuable members of the healthcare system. And in fact, without CNAs, healthcare wouldn't be the same. CNAs have many roles, such as turning patients every 2 hours if they are considered to be bed rest, taking blood sugars by doing AccuChecks, answering call lights if a patient needs something, communicating with patients to see how they're feeling, and to be there for them if they're having a rough day. In healthcare, nurses depend on CNAs because nurses have their own job to do, such as medication administration, educating patients, educating their families, and etc. The list goes on and on. The reason why nurses depend on CNAs is so they can get the smaller things done so that 12-hour shift could go smoothly. It's also important to mention that CNAs do take vital signs and help monitor on whether or not the vital signs fluctuate. And it is the duty of the CNA to report vital signs to the nurse. Another role of the CNAs are positioning the patient, lifting the patient, and even transferring the patient. For example, if a patient needs to go down to MRI or CT, the CNA is involved with that task to transfer that patient to a cart to bring that patient down so they can get their imaging completed. CNAs are considered to be highly in demand, and CNA jobs will always be available because healthcare needs CNAs. In this video, I'm going to list the top 5 reasons on why nurses should be CNAs before starting their career paths. This video is so essential for all nurses. So the first reason on why a nurse should be a CNA before beginning their career paths is because as a CNA, you learn prioritization skills. So why are prioritization skills important, you ask? Well, if you are in nursing school or planning on going to nursing school, as a nurse, you need to know how to prioritize certain tasks throughout your 12-hour shift. So as a CNA, you are practicing that in your shift as well. For example, if bed 1 asks for a glass of water and demands that glass of water right away because their throat is dry, but bed 2 requires a blood sugar because they are feeling a little dizzy and lightheaded, which patient would you prioritize first? Well, the answer is clearly bed 2 because we need to prioritize what is most important first. You gain these skills as a CNA, and the reason why a nurse needs these skills is because the nurse will be experiencing same situation but on a higher level. So if a nurse was a CNA prior to becoming a registered nurse or a certified nurse, they understand the skills of prioritization because they have gained the experience as a CNA. Also, CNAs have so much going on in their shift, and it's the same for a nurse as well. So since you are working that 12-hour shift as a CNA, you are really gaining that prioritization skill experience. So by the time you graduate from nursing school, you already know how to prioritize patients like an expert because you've had that experience. Let me give you another example. So the patient in bed 1 wants to call their family using the mobile phone that's on the unit to bring him lunch. Patient 2, on the other hand, is sitting on the commode and just took a blood pressure medication, and that blood pressure medication is now kicking in, which patient are you prioritizing first? Is it patient 1 or patient 2? If you answered patient 2, you got that correct. That's the first patient you should see first, because we don't want that patient to fall over and hurt themselves, especially if they're on anticoagulants such as Lovenox and heparin, where they can hit the floor and bleed. Okay, so second reason why nurses should be CNAs before becoming registered nurses or certified nurses is because as a CNA, you obtain communication skills as you are working. You learn how to communicate properly with patients and know the ins and outs of how to speak to a patient. Clear and concise communication with patients are a must. Those experiences are gained as a CNA. So that's another reason why it is important for a nurse to become a CNA. For example, if a nurse is having difficulty communicating with a patient and was never a CNA prior to becoming a nurse, that is where the flaw kicks in. It's because if a nurse was a CNA prior to becoming a nurse, they would have gained that communication skills. Think about it. In a hospital setting, sometimes they give you 6 to 12 patients, depending on where you work, and if not even more, you're communicating with 6 to 12 people for 12 hours a day. So imagine the amount of communication skills that you are gaining just from one shift. So if you worked as a CNA for 2 years, you already know how to communicate with patients. The only different types of communication that you learn as a nurse is therapeutic communication, and that you learn in mental health as a nursing student. Also, as a CNA, you're learning how to de-escalate situations. For example, if a patient is combative and is angry about a specific issue, you learn how to de-escalate situations so the patient doesn't become even more upset about whatever they're mad about. So that is a skill that you gain as a CNA. A lot of people ask me, should I become a CNA before going to nursing school? And if you have the time and the availability to do that, I would say yes, you should do that, because you are gaining all these skills that you don't think you are obtaining, but you will be obtaining incredible skills that you don't think you will be using as a nurse. But in fact, you will be using those skills on an everyday basis as a nurse. So yes, that is the answer. And I understand there are also other professions within the hospital setting. For example, transporters also have to communicate with patients as well, but it's not on a continuous basis. They are communicating with patients, but they aren't always in the patient room and communicating with patients every minute within those 12 hours. So that's something to keep in mind on why becoming a CNA is very important before going to nursing school or becoming a nurse. So the third reason on why nurses should be CNAs is because you learn time management skills. Time management is extremely important if you are a CNA because, for example, if you have Mr. Smith on the commode and another patient wants their water, you just need to explain to the patient who wants their water that, hey, give me 10 minutes, I'll come back, I need to take care of another situation, give me some time, and I'll be back for you. So that's where communication skills also come in. You are also prioritizing your time management as well. You're managing your time correctly. Also, CNAs have so much going on within their shift. Patients need to be turned, blood sugars need to be checked, meal trays have to be passed, patients need to go to the bathroom, etc., etc. So you need to think about how you're gonna manage all those tasks within that 12-hour period. And that's where CNA brain sheets come in handy. If you don't know what a CNA brain sheet is and importance of a CNA brain sheet, and if you are a CNA, I would most definitely say get yourself a CNA brain sheet to help prioritize and control your time within your 12-hour shift. I do offer CNA brain sheets on my Etsy page. I'll give the link right here. Check out that website. That is where I offer CNA brain sheets to help CNAs with time management skills. So the fourth reason on why nurses should become CNAs is because CNAs are exposed to hospital environments, meaning you are learning what nurses do on a daily basis. And this is great, especially if you're considering on going to nursing school and becoming a nurse. You see what nurses do on a daily basis as far as giving medications and how they communicate with patients. So you get to be exposed to all different types of situations within the hospital setting. And the way I think about it is that you are getting free education as well, because you are seeing physicians and nurses and physical therapists and all other healthcare workers that are working together within the hospital, collaborate with one another, and helping patients become healthier. The reason why I obtained a CNA position is because I just cared more about the learning experience that I was obtaining. Every time I worked as a CNA, I learned so much throughout my shifts. Like I mentioned, I learned time management skills, I learned communication skills, prioritization skills. I've learned so much, and I learned so much about the hospital environment. And that was such a huge benefit for me since I am a graduating nurse. So another reason on why nurses should become CNAs, and the reason I left this one at the end is so I can have a discussion about the issues within nursing. I have experienced a lot of nurses who just jump straight into the field of nursing with zero experience as a CNA, so they rely mostly on the CNA for all activities that go on with our patient. Keep in mind that the CNA and the nurse share the same patient and are supposed to be collaborating with one another and working with each other to get tasks done and provide patient care. But sometimes I do experience a few nurses who are having difficulty turn patients correctly, or are always just paging you and asking you to do specific things. I get it, as a CNA, you do have tasks to complete, but as a CNA, you're also supposed to know your scope of practice as well. If a nurse asks you to do something specific that is out of your scope of practice, you just need to communicate with them saying, hey, I don't feel comfortable with that. Can we do it together? As a CNA and as a nurse, you're supposed to be empathetic and very compassionate to all patients, no matter what. As a CNA and a nurse, you are supposed to navigate very delicate social interactions. So that goes with patient care and communicating with nurses as well. Becoming empathetic is also another part of the job, and showing compassion is also another important quality that a CNA is supposed to have, and something a nurse is supposed to have as well. Hopefully you enjoyed the video. If you did, make sure to give it a like and subscribe if you haven't, and share it with your friends if you found the video beneficial. Also, make sure to comment below to add why else a nurse should become a CNA. Let's have a friendly discussion within the comment section. Make sure to place your comment below. And with all that being said, thank you for watching and have a great day. Tribe Nursing signing out.